This is a rehabilitation protocol for arthroscopic partial meniscectomy. On the day of surgery, you should use ice or a cold therapy unit over the leg for 15 minutes every 1 to 2 hours. Begin taking pain medication as soon as you have pain. Begin eating with liquids and light foods and progress your diet slowly over the following 24 hours. Keep the dressings on the surgical site to your first post-operative visit. Usually this is 7 to 10 days after surgery. You may bathe or shower, but keep the dressings completely dry and the bandages on. Do not swim until instructed by your surgeon. Continue to use crutches until your first post-operative visit or instructed by your doctor. If you receive a brace, you may discontinue it when you are walking comfortably. Do not drive until instructed to do so. Contact a physical therapist prior to surgery. We will give you a prescription and list of recommended facilities prior to surgery. It is normal to experience some swelling in the knee and leg. To decrease this, keep your leg elevated above the level of your heart as much as possible. Avoid putting a pillow behind your knee, as this can cause problems getting your knee straight. There are 3 main phases of rehabilitation in addition to the early post-operative phase. In the early post-operative phase, the goal is to control pain and swelling. In physical therapy, you will be resting, icing the knee, doing active and passive range of motion, and quadriceps isometrics. Discontinue crutches when comfortable and walking with a normal gait. You will be working on straight leg raises where you lift your leg 2 feet off the ground and hold it for 10 seconds. Do a minimum of 3 sets of 10 repetitions. Do this with your brace locked in full extension. Quadricep isometrics involve tightening your thigh muscle and holding for 5 seconds. Do a minimum of 3 sets of 10. Make sure you do this with your brace locked in full extension. Patella mobilization involves moving your kneecap from side to side. Move the kneecap towards the inner side of your leg and hold it for 5 seconds. Next, move it towards the outer side and hold it for 5 seconds. Do 3 sets of 10 repetitions in each direction. This will be harder to do until the bandages are removed. Heel slides involve bending the knee and sliding your heel towards your buttock. This may be done with assistance of a towel to pull your foot, as demonstrated in this photograph. Bridging exercises involves rolling a towel and putting it under your heel with nothing under your knee. Keep this position for 5 to 10 minutes. You can assist this by resting your hand on your thigh near your knee. Calf pumps involve moving your ankle up and down to prevent a blood clot and encourage blood flow. Do this 10 times an hour. Phase 1 is from week 1 to week 6, and the goal is to regain full range of motion. You will work on active and passive knee range of motion, quadriceps and hamstring strengthening, wall slides, step-ups, steps-downs, hip and core strengthening, proprioceptive exercises. Stationary bike and elliptical are both okay. You will learn a home program to do on your own. In phase 2, from week 6 to 12, you want to improve quadricep strength and improve flexibility and progress towards sports. You will add squats and leg presses and lunges, advance in proprioception exercises, and begin jogging. In phase 3, from 12 to 18 weeks, the goals are sports-specific activities and running pain-free. You will continue the strengthening program, work on your quads and hamstrings, and continue running and gait evaluation.